this talk today that we have seen 16 different press releases about COVID-19 since March the 12th, and I believe this may be our 7th press conference. But we really want to be sure during this whole conversation we're having with you in our community that we kept you informed. Really, the purpose of today is to have a conversation about AbiMar, and more importantly, in regards to how they responded, how we have responded, and then a tidbit of how we will move forward in that regards. I'm very remiss if I didn't once again just thank all the team that is helping us lead this community. At the very top of the list, Congressman Arrington did a phenomenal job, particularly early on, and providing feedback on kind of a national level. There have been several situations where we needed a chance to address things from the governor's office, and Representative Glasser in his office did a great job in that regards. Of course, we've had daily conversations with CDC and HHS, even having an opportunity to be invited to a couple of White House conference calls for municipalities and counties. Judge Bowles, we talk daily. In fact, the judge will be also has remarks in just a bit following me, and with the judge is our Judge Pro Tem, Chuck Stadler. So I'm going to present just a little bit. Following me will be Judge Bowles, then Annette Lerma, Director of Health Services, Robert Hanna, our City Manager. Then I'll come back and open up and allow me to ask any questions at all. Before I get started, I want also to communicate that we've been engaged with the governor's office as well as listening to what the president has said about reopening our economy. I'll give you more details later, but I've asked Brad Holland, CEO and President of Henry Medical Center, to co-chair with Mayor Pro Tem Hurt in regards to how we open up Abilene. I think it's very, very important. And I want it to be a very healthy tension between the business sector and also the health sector and help guiding us so we do things in a way that's appropriate. As you may saw over the weekend, the DCWA board approved $3 million that we use to help manufacturers and industrial companies in our community. I made an ask about a month ago from the foundations, and they responded with giving about $250,000 to help our families in need. So we'll talk about the details of recovery at another opportunity, but I want to be sure that you are aware of the things that we're planning to handle COVID-19 and also the recovery of this community. AbiMar has been a good partner, employing over 600 in our community. But when Annette Lerma and those working with her identified a potential problem, we acted very, very quickly. One thing we talked about is we wanted to be proactive. And so I think because of the work of Director Lerma and her staff, we were able to address a situation otherwise could have been very, very significant in a negative way for our community. Annette will provide kind of a timeline of her engagement, AbiMar's response. Mr. Hanna will provide an opportunity to provide some remarks from AbiMar. And again, I'll come up at the very end and provide a chance for the media to ask some questions. We will be disseminating information to you that AbiMar's provided for us because we want you to be informed. Again, I want to thank the whole team for collectively, in a collective way, providing an opportunity for us to address this as a community. Judge Bowles will now have an opportunity to say some things that he wants to say, particularly in regards to AbiMar. Judge Bowles? Well, one thing about biotechnology, it doesn't always work the way we want it to. So what I'm going to do is say a few things about AbiMar, and I guess I'll do a segue to Director Lerma, and if we can get the judge up before we let him provide some remarks. And so
Mr. Mayor, I'm ready if you're ready.
Okay, all right. It's all yours.
Thank you very much, and I apologize for the technology still facing some challenges. We're a little slower than everybody else over at the county. We've just got to do this stuff in person. But I want to thank you once again for the opportunity to be here this morning, and just echo on your comments this morning, Mr. Mayor, about this is a team approach that we all use here. We work together. I can tell you that we have a group of people who meet every morning at 8 o'clock. Called the Unified Command System, and they talk about these things and where we are and what we're going to do and how we're going to follow up with it. So it is a joint effort and involves so many people that are as part of this. So I want the citizens to be comforted by the fact that this isn't one or two guys calling all the shots here. It's a great team effort, and it does involve an awful lot of people, so we're very thankful. A couple of concerns I have, just very quickly, and one of them is looking at the numbers. The numbers do concern me. We've seen a spike here recently, but I don't think necessarily we're over the top. We just have to watch it for another couple of days. And so the numbers look promising, but I was out over the weekend, and while we have found most places are coming up with some really good ways of dealing with all of the restrictions we have here, we are having a few problems where people are still circumventing the systems that have been put in place. And so all that does is put more people at risk, and when it puts more people at risk, it delays moving through this. And so we just want to go ahead and remind people, keep doing what you're doing. Wear your masks if you're going to be in a group of people. Those things aren't mandatory yet, but there's always a possibility that might happen at some point in the future if people don't voluntarily take the steps to do this. Our citizens have been very voluntary in what they have done. We appreciate everything they are doing. Big question I get from a lot of people, and one was so well verbalized to me this morning by our emergency manager, was that people want to know, when is all this going to go away? When are we going to be able to get back to things? And I don't know when we're going to go. I just don't know. I don't have a timeline yet. We're taking it 2 weeks at a time and trying to figure out where we're going to be in 2 weeks. And as we move forward, I think the governor has given his indication that he wants things to return as normal as they can be. But the days where you're never going to need a mask again, I don't know that that's coming. We're just going to have to wait and see where we are as we continue to move through this and what this disease holds for us in the future. We'll just have to wait and see where we are. But the public, once again, is doing a great job, and I want to assure them that the government doesn't want to be any more intrusive than we absolutely have to for protecting the citizens. And because this is a disease that is transferred from person to person, it does make it volatile when you have large groups of people and when you're not taking those distancing requirements. The other big question I get is about essential services. Am I an essential worker? Am I an essential function? We do have some guidelines from the Department of Homeland Security that are addressing those, and but they're leaving it up to the local officials to determine whether or not those are essential. I want everybody to know and understand we do get it. We know how the economy works. We know that there are people who produce things and there are people who consume things. And for the economy to work, we have to have both of those groups. And so we do try to not be so restricted that we can't allow the community to function as it should. If you have a business, if you're stuck at home right now, see what you can do online. That's what a lot of people are doing, is working from home to keep their businesses going. And if you can't, if you have to be in the office, then look at the steps you can take and get creative with it. Figure out how you can keep your number of people down to 10 or less. That's set by the state. And also make sure you keep that separation there. So I say the numbers look pretty good, and I think that sort of gets us into the discussion about AbiMar, because that is the one that has really kind of jumped into the headlines recently. They are a large employer in the community. We understand that, and I think they are working as diligently as they can to try to get things back in order and get open for business once again. And that's, I do know that they do have a cleansing team in place today that is beginning the job of getting inside and stabilizing that facility. So they're working towards it. They have been very responsible so far in what they have done. And we just want to let them know and let the public know as well that we continue to work in their interest and continue to work in trying to make it as safe a community as we possibly can, given all the challenges that we have. So that's all I've got this morning, and I'll be standing by for any questions from the media today. And Mr. Mayor, I'll turn it back over to you, sir.
Director Lerma?
Thank you, Mayor. I wanted to speak specifically about the proactive measures that AbiMar has taken and to give some details about the efforts to slow the spread of the outbreak there. So first, I want to acknowledge that no one is able to stop or completely prevent this virus from spreading. Our goal from the beginning has been to slow its spread and work quickly once a cluster is identified, which is exactly what happened in this case. The first time I met the CEO of AbiMar was last month on March the 17th when he attended a symposium that was hosted by the City of Abilene that was organized specifically for local businesses to help plan for operations once COVID-19 hit our community and affected our workforces. He shared with me at that time the steps that they were taking at their plants, and we exchanged business cards. Since that time, my staff and I have had a close working relationship with him and his staff as they have sought advice even prior to identifying the very first case in Abilene. Their establishment of an emergency response committee, early implementation of thorough screening of all of their employees as they report for daily duty, shutting down the third shift each day to dedicate it to cleaning and disinfecting, and sending 90% of their administrative staff to telework have been just a few of over the 50 different measures that they identified that they were implementing that indicated they were serious about integrating all of the CDC recommendations. Once they began to identify cases, their team did their own investigative work about who was connected to whom within the organization and immediately quarantined exposed staff. As of last week, they had over 100 employees who were in quarantine and they were operating at less than 30% capacity. These employees continue to be paid, and they have acted each step along the way by putting the health and well-being of their employees at the forefront of all of those decisions that were made by AbiMar. After several cases were identified, there was a doctor from Abilene Diagnostic Clinic who reached out to the health department and to the CEO of AbiMar to offer mass testing of all of their employees. AbiMar immediately accepted this offer and voluntarily closed operations and agreed to pay for the testing of 100% of their workforce. With over 500 or 600 employees, it has been a challenge, but it is providing a great opportunity to understand the spread of the virus from a population perspective. It has been interesting to see that there are some who tested positive that did not have any symptoms. This is consistent with what has been reported in other parts of the country and around the world, that there are those who are carrying the virus and do not know. Does skew the statistics some, and it makes it difficult to understand the true impact of this pandemic. One model that we use to predict infection rate of a population uses 30%, meaning that you can expect to see about 30% of your identified population to become infected with the virus. There are many different models that use different rates, but this model, using this model and comparing it to the infection rate at AbiMar, which is the identified population or the cohort that we're investigating, the infection rate has been less than 10% using the numbers available today. So this is significant because although the virus can't be stopped, the spread was limited to no more than 10% of their workforce. So this doesn't mean that we don't still have work to do. We have been on numerous conference calls with AbiMar leadership to determine how we can partner with them to educate their workforce about how to slow the spread while away from work. Many of their workforce are close-knit community outside of work, and communicating the importance of isolation and quarantining of themselves and their close contacts is a high priority for us and our staff. We will be disseminating written materials, connecting with identified leaders and their circles of influence to enlist reinforcing the messages, and continuing daily phone calls from case managers to ensure that there is understanding and compliance. This will be our top priority from within the health department for this particular cohort. And I believe that the city manager may provide some more information about a tiered plan for reopening but just to ensure that the community knows that we are working very closely with them to identify safe ways for them to reopen and reintegrate their healthy employees and continue the close monitoring of their workforce to continue to contain the spread. If after reopening and we identify new outbreaks, they are voluntarily going to adjust their plan as we move along. Their employees, as they continue to say, have been their top priority, and they have shown that throughout this process. The health department and the city will continue to partner with them and other businesses to ensure that we are all being proactive about slowing the spread. Thank you.
City Manager Robert Hanna.
Thank you, Mayor. I wanted to start by just saying good morning to everybody. A few years ago, I was able to travel to Medellin, Colombia, and I really saw firsthand how AbiMar's parent company treated their employees with a high sense of humanity. And so it's not surprising to me then that AbiMar has led out among industries in Abilene by voluntarily and comprehensively testing their employees and providing paid leave of absence for their employees sent home on self-isolation. AbiMar voluntarily suspended operations on Monday, April 13th, and they have put forth and identified a phased approach for reopening that will serve as a model for other industries in Abilene that may be impacted similarly by the community spread of COVID-19. While we do not believe that AbiMar is a source of contagion itself, but rather symptomatic of an employer working to contain spread within their workforce, the phased approach begins with a comprehensive deep cleaning and sanitation process. And once completed with the cleaning and sanitation, AbiMar will restart production in both the north and south plants on a reduced basis. Production will increase over a total of 4 phases. The advancement to the next phase of production level will be based on test results, labor availability, reducing or limiting points of high concentration of people where social distancing is difficult, and continued innovation. AbiMar has been exceptionally proactive in dealing with the COVID-19 pandemic, and I anticipate they will adjust their reopening plans as they learn new information. I want to highlight some of the innovations that AbiMar is implementing or attempting to implement pending a sufficient number of tests. And some other businesses may choose to implement these once additional tests are available for the community as well. 1, only tested individuals are allowed to work at AbiMar. Any new hire will be tested for COVID-19 before entering the plant. The company will continue to undertake and reinforce strict health and risk screening for each shift. That means is that as the employees come into the factory for their shift, they'll do temperatures, they'll do a screening, where have you been exposed, those sorts of things. And if they have been exposed or any symptoms have been detected in the screening, they'll be sent home for self-isolation. In addition, masks and gloves for all employees. Some employees will be wearing face shields depending upon the critical nature of their role and what they're doing. The governor has put together a task force to reopen Texas, and the mayor has discussed doing the same for Abilene. And nobody, believe me, nobody is more relieved to hear that than I am. But I must also caution Abilenians that we are still in the middle of our peaking process. And while I do not think we will see the numbers some models are predicting, I cannot say that we are seeing a sustained downward trend, but perhaps we will see one soon. So in the meantime, I'm going to urge everybody to please be responsible in your actions and practice good social distancing. Thank you, Mayor.
We will have an opportunity for the media to ask some questions. I want to just restate some things. Texas has done very well. Texas represents about 2% of all the infections nationwide, and West Texas has done very well, and Abilene has done well. And I say that to say this: we've done well because our citizens have responded appropriately. And although we've had isolated situations where we've had some incidents we've had to address, I am very proud in the way this community has responded. And as we open up, Abilene will be dependent on that behavior. As I mentioned, I've asked Brad Holland, CEO and President of Hendrick Medical Center, as well as Walden Hurt, Mayor Pro Tem, to have to co-chair an effort to see what that looks like and customize that effort based on this community. Judge Bowles and I, as well as Robert Hanna and Judge Pro Tem Statler, will talk about AbiMar and its reopening. And the four of us need to feel good about the reopening. Thus far, we do, but we're still monitoring that situation. We talked about being transparent. I think that a number in the community know the composition of the workforce that AbiMar represents. Director Lerma has engaged the IRC as well as the Abilene Housing Authority to help us help those employees so our community can be better responding to this virus. West Texas mayors, we've met 3 times virtually in the last few days to talk about West Texas, and we'll be forthcoming in regards to how we're working together to help each other reopen our communities. And with that, Ms. Cockrell, we'll open up for media questions.
Sounds good. And what I'll do, I'll just go down the line from how it appears here on my screen. So Nate and Trav, do you guys want to unmute and ask any questions you might have?
Yeah, Mari, or Mayor Williams and Mr. Hanna, we'll start with you guys. Can you tell us exactly when the first test came back positive for an employee of AbiMar, and did they wait too long to test other people?
Annette or Robert, you want to answer that question?
Give me 1 second, and I will pull up the document. 1 moment, please.
And while the city manager is doing that, I'll also note, and Annette, you can provide clarity, a number of asymptomatic employees existed at AbiMar. I believe from the onset, and we'll provide that time frame, temperature checks were being checked, as well as all the pre-screening by the CDC.
Yeah, March 30th was the first positive test for AbiMar in comparison to the city of Abilene's first positive test, which was on the 26th of March. So not 4 days after AbiMar had their first positive case. It wasn't until the 10th of April that they had 5 confirmed cases, 4 in the North Plant and 1 in the South Plant, and more than 100 people on preventive paid home isolation by the 10th of April. And on the 13th of April, as I said, they did stop production in both plants. So I think they monitored the situation fairly clearly and began taking some strong measures to implement community spread within their plant.
And so I'll just add to that they were testing all along, not necessarily as a mass group effort, but their employees continued to be tested prior to this time period of mass testing. So those employees that were identified that were symptomatic and were at high risk, they were being tested. So there was no gap in testing. It just wasn't being reported out as AbiMar, if that makes sense.
And I'll tell you, we received dozens, if not more than that, of calls from employees at AbiMar claiming that there was some cross-contamination between the different plants. Can you talk to any of that? Because there's a lot of claims up there that not enough was being done.
I'll say that, and Annette, I'll let you chime in afterwards. I think there's a lot of fear out there from people about this virus. But I think AbiMar's worked in lockstep with the health department throughout the whole process. And at no time has the health department felt like AbiMar was being anything other than a responsible corporate citizen who cared deeply for their employees.
And I agree with that. I think in the absence of someone being told directly that, this is the positive patient and, what they needed to do, those people that were in direct contact with those identified positives were notified. And so when other people around the plant weren't given specific information about that case, I think in the absence of information, people tend to panic. But I feel confident that they were taking care of those employees who had been identified as direct contacts.
All right. Nate, would you like to ask anything, or?
Yes, I did have one question as well. Given that many of these people have been asymptomatic, is checking for fever, is that going to be enough?
I don't know that anything would be enough, because even the ones who become symptomatic, it's shown that they could be shedding virus up to 48 hours prior to being symptomatic. Well, how do you know what 48 hours is? How do you isolate yourself before you become symptomatic? So again, I just remind people that we're not going to be able to stop the spread. There are going to be some people who get sick, but identifying them quickly as soon as they become symptomatic, or even isolating or quarantining those ones who have had that direct exposure, those are the most powerful tools we have, where there's no way for us to predict 48 hours prior to someone becoming symptomatic, if they even are going to become symptomatic. So it's the best we have.
I'd also add that we can't lock down Abilene and everybody forced order to stay home and never come out. That's not even unrealistic, but it's impossible to do. And what we can do is make sure that we are responsible for ourselves and that we exercise good social distancing practices. This is why they say stand 6 feet or more apart. This is why they say don't gather in 10 or more folks. The CDC has issued guidelines for industry to work in environments. AbiMar has followed that. Other industries in Abilene are doing the same. And we're taking all necessary precautions. But Annette's right. People will get sick with this virus. We've had 2 deaths already in Abilene. I pray to God we don't have any more. But by and large, I think our community's done an incredible job of responding to this. And I'm very proud of our citizens and our businesses. They've been predominantly responsive and responsible. It's a big city, and we've got a lot of businesses, and not everybody's going to behave well. But for the most part, we've really come together as a community to help solve this.
Next, I've got Heather and Casey, you up on my screen. Would you like to ask any questions?
Sure. I guess the first question I have is just about the availability of testing. This situation at AbiMar seems pretty unique that they were able to test over 500 people. Would another employer in Abilene be able to say, I want to test all of my employees? What's the situation with the number of tests we have in Abilene?
Annette, you want to take that?
Sure. So that's a great question. I will say that it is beginning to improve a little bit. We at the health department have different access to testing compared to the private sector, those providers. So they are able to get a lot more testing supplies than we are here. Our lab, which is a regional lab through DSHS, limits our criteria to very strict criteria of only symptomatic people. And so we have to operate based on that. The other private providers do get a lot more testing supplies. So as their volume increases, they can order more from, depending on how many different labs they're contracted with, those laboratories will send them testing supplies. And because Abilene Diagnostic is one of our larger test sites, they're able to receive more of those testing supplies. But that's not to say that there is an opportunity for every business within Abilene to do mass testing on their employees. The way that we've tried to handle it is, I know that the way Abilene Diagnostic is focusing is, once we start to identify a potential cluster, then they may be reaching out directly to those entities to say, how can we help? And so they'll continue to do that, and we'll work together to try to identify businesses that need and that are willing to go that route.
You talked about maybe 10% showing up as positive, at least with the AbiMar population. I had a chance to talk to a positive COVID-19 patient last week, and in him telling his story, it was really hard for him to get anybody to test him initially. It wasn't until he was on the COVID floor that he was even tested. And then his wife and daughter were sick, and a coworker were sick. And so out of 4 people in his life, 3 of them were never tested. And so I guess I'm wondering, that 10%, I mean, how confident are you?
So it's not anything that, again, it is all an estimation. So to speak to your specific scenario there, the way that we've been able to reduce the burden on those testing supplies is once someone becomes positive, they have been tested and they're identified. A lot of times, if those people that are in their direct circle of contacts, when they become symptomatic, we just presume that they are positive and we try to treat them as positive. You take the same precautions, you isolate yourself, and you wait for your symptoms to subside. If they need medical attention, we certainly encourage them to reach out and talk to their provider. If they need to, get emergency care, that definitely is something they need to do. But seeing as there is no treatment, testing doesn't really do anything, because it doesn't say, oh, I've identified you and now I can provide you with this specific treatment and you will get better. That's why we tend to use that method, just to preserve tests.
The other thing I'd say is that it's important when people are sick, they just stay home. That's why from day one we preached, if you feel ill, stay home, don't go into work. If your employer says you have to go into work, don't. There's no one is requiring you to go into work. Now you have to take responsibility of that choice of actions. Your employer may say, okay, we're done with you. And I recognize some people don't have the luxury of doing that. But it is the best course of action if you feel sick to stay home. If you feel sick and you can't stay home for whatever reason, maybe it's because you're in an essential position, you have to come into work, wear a face mask, take the CDC guidelines and precautions to do that. And if you have concerns, call the health department. They'll be happy to provide you with some direction. But the bottom line is, with people who are asymptomatic, with people who are symptomatic, and with people who are put in a position where they have been tested positive and their loved ones are living with them still, stay home. It's critical. That's an important part of social distancing.
I have 2 more questions. I'll try to be brief. One is about the decision to separate AbiMar's numbers out from the community cases initially, and now to include an asterisk with the numbers. I mean, it would seem to me, and I think a lot of people in the community are wondering, why put an asterisk? Are these people not part of the community? So I just would love to hear you guys talk through that decision.
So that was all my decision, and I'm going to give you the logic behind it. One, I wanted to make sure that we were being transparent with our numbers, okay? And based off some direct feedback from the community, based on some Facebook stuff I was watching, it was pretty clear that people were confused and it was not working. And so I think the asterisk is a little more easier to understand. They are part of the community. Don't get me wrong. That's not what we're saying. They're an integral part of our community. But the format we use to show total community-wide, total AbiMar, it just wasn't being well received. And so we switched back to the previous way of doing it and just pulled out the AbiMar numbers with an asterisk.
And I'll say this, I think Director Lerma, I think City Manager Hannah, I think all of us involved want to be transparent. And so that was an effort to be sure that nothing was being done to conceal anything, but trying to, in a painstaking way, communicate exactly the reality that exists in Abilene, Texas.
Mayor, my last question was for you. You guys had talked about looking what the governor is doing with reopening. And I know that maybe a week or so ago, we were looking at the peak coming maybe in early to mid-May. Have you guys gotten a new estimate for when the peak may hit this region? And how is that kind of fluid situation affecting your plans for reopening?
Well, and it is very fluid. And we've not shared a lot of numbers because a number can change within the next hour. I will say this, that the original projections that were made a month ago are far, far less than what they're shown to be. We think the peak is near. but that is a constant and daily conversation. And so we're anxious to get back to work. I think that Brad Holland and Walden Hurt will provide great guidance of reaching out to community. And I mentioned before, I want a healthy tension between the private sector and the health community to help drive that. And so we do anticipate the peak nearing, but at this point, we've not reached that point yet.
Thank you.
I've got Brian next, so I don't know if Brian and Laura and Tim with Reporter News want to go next.
This is Laura. I got a couple of questions. In the spirit of transparency that y'all have been talking about, where are the numbers about the demographics and the treatment for the AbiMar employees?
I think part of that information is still coming in. Annette, you may want to answer that or correct me if I'm misspoken.
Right. So we did not receive those results in the same way that we received the results from all of our other reporters. And so since it was such a large group, those demographics were not reported immediately, even though we got their name and contact information to be able to reach out to them quickly. It's quite a tedious process from the Abilene Diagnostic Clinic's perspective because they're having to match names. They're also testing other people within the community as well. And so they're having to separate out and keep those tallies differently and manage on a different spreadsheet. And so it was really just about logistics. So everything is still kind of being matched up and verified. So we were just getting a number, and those names and contact information were coming in separately. But we can still provide those once we get, the full disclosure.
Are any of the AbiMar employees hospitalized? Because your hospital numbers have been like an 8 for 4 or 5 days.
Not that we know of. I'm not the one who manages the data, so I don't want to say for sure, but I don't think so. We have a hospital representative from both of the hospitals in our morning unified command meeting. And so that was not indicated this morning specifically. So not that I am aware of.
Okay. And again, in the spirit of transparency, what about numbers for other entities in town? We're hearing a lot of chatter about the State Supported Living Center having some cases out there, and those numbers have not been made public.
So if we get to a point where we feel like there is a cluster of folks, we'll take a similar approach to what we've done with both DRI and AbiMar, which is try to be as transparent as we possibly can. But to single out any business that may have 1 or 2 people, I think is problematic. But we are looking at the state school, and if we need to make an announcement on that in the future, we will.
Thank you.
Thank you.
I'd just be curious. I mean, what's being done, sort of just in general, not just with AbiMar, but sort of our procedures on following up, tracking through the community, and making sure that the people who are quarantining who are supposed to be doing that actually are. I mean, I know you can't go to each individual home and make sure, but is there some sort of procedure?
So there's a process we follow, Brian. And if we have evidence that someone may not be self-quarantining like they're supposed to be doing, we can get a health order. The health order then confines them. If they violate the health order, we can go through a court process and do some other things. If I felt it was an imminent threat, we might do some other things too. But the bottom line is most people that I know of are complying. If they know they're positive, they're trying to comply. The other thing I would also say is that some people don't even know they're positive, right? Or their symptoms may be so mild that they don't feel like it's a thing. So we all have to be responsible in this. We all have to use to make sure that we are behaving responsibly and appropriately. But we also provide grace to people too, right? And so one of the things I just ask folks to do in the community is if you see or know of somebody who is positive and may be out and about, let us know, okay? Our goal isn't to go bust heads or, crack skulls, but our goal is to make sure that folks are being responsible. We have a gentleman in our isolation site. He's been compliant for the most part, but he's in there by himself, and he's got 2 officers with him that are kind of just watching, make sure he, from a health standpoint, but also to make sure that he stays in the building. But it's self-confinement, self-quarantine is not fun, and at some point in time you want to stretch your legs, and so we just have to be responsible is all I'm saying. And then add to that whatever you want to.
So we're still managing them. Our case managers, which can be one of our providers or a nurse, they will call these positives, and depending on their situation, they may touch base with them once a day or once every other day, just to check on them, make sure they're doing well, that they're recovering as expected. But there have been a few that we have been unable to get a hold of. The number that they provide on their sheet when they get tested is not a working number. And so we try every avenue to get a hold of them. If we've got a place where they worked, we will try the lab where they were tested. But the reality is that it may not be a completely perfect system. It is only as good as the information that we get. So there may be someone who has identified themselves to their family that I am positive, and they may not have the information that they need, that we've been able to communicate directly with them. So that has happened on a couple of instances. So it's the best that we have.
And Mayor, you sort of indicated that we've got Weldon and other people working on kind of our roadmap going ahead. I mean, when do we expect to kind of have a sense of where we're going and how we're going to do that? How quickly do you anticipate that we'll have that?
Well, a few different things. First, the governor's announcement next week on the 27th will dictate a number of things, and so we want to reopen, but under the confines, the parameters that the governor gives us. And so the Chamber of Commerce has already started a lot of legwork led by Doug Peters, and they'll work with Weldon and also Brad, but we need to follow the guidelines from the governor and CDC, but we're ready to engage in ways where we can put people back to work. But we want to do so in a very cautious way. And the new norm will be a little bit different than what we've done things in the past. This virus will be with us. One thing that Director Lerma talked about is that there is anticipation that 25% or 30% of Abilene's will get the virus. Well, that could be 30,000 people in Abilene, Texas. And so we just want to be mindful of that. But I mentioned that to be sure that the various phone calls, texts, and emails I've received, that we hear you. And so we're going to respond, but do so in a very responsive way.
Thank you.
Brian. Scott, I've got you next. So if you and John have questions there from K-Texas.
Most of my questions have already been answered, but we did have somebody send in a question. A restaurant owner is asking, what makes a restaurant any more dangerous than, say, an overcrowded grocery store?
So I'll answer the question. I think it's the proximity of one table to the next and the prolonged exposure to that person. I will know the Texas Restaurant Association is working with the governor to provide meaningful and appropriate ways that the restaurant industry can reopen for in-dining. Hasn't happened yet. And until the governor, regardless of what we do in Abilene, until the governor says you can go to a restaurant, you can't go to a restaurant. So it's not so much Abilene doing that as the governor, but we have to abide by his order. My hope is, as the mayor alluded to, is that we see some things phased in the very near term that are both prudent and responsible in regard to spreading the virus.
I have a question, if I may. Good morning, everybody. The first positive case was March 30th. We have just learned that today. By April 10th, there was 5 positive cases, and by that time, 100 employees were quarantined. On the 13th, the company voluntarily shut down. Did the city get involved at any point in time in that 2-week period and advise AbiMar to close operations?
Ned, I'm not aware of us advising them or telling them to shut down. We communicated with them consistently throughout. But Annette, why don't you tell your story on how that all played out?
Yeah, we had many conference calls with them as they kind of would implement different measures or had different concerns or questions. We sat down on a conference call with them. They had talked about the masks and how they were having their employees mask up. And so we felt very good as the health department that they were being as proactive as they could. Again, with the number of employees that they had, when we looked at the numbers, it wasn't any more alarming than what you would expect out in the community. So when the idea of closing down was really their suggestion, they had said, we are thinking about doing this. Do you think that that is prudent? And we, of course, said, well, to be proactive, if you are willing to do that, we would certainly support that. And they did. They chose to do that when they were offered the mass testing of their employees.
The city, several weeks ago, sent out a warning to the public about Walmart because we had a customer that had a positive case and we had a deli worker that had a positive case. The city sent out an email telling anyone that was at that store between specific times to self-quarantine. Why hasn't the city done that with AbiMar, with the possible exposure to the public of employees and their families?
I think from my perspective in that, if I could go back in time, I probably would have required that press release to be changed to follow more in line what I saw from some other communities and also the United States Air Force, which is basically if you were in contact with a person like this for, within 6 feet for longer than 10 minutes, you need to self-isolate. The way we did that, I regret the fact that we set that out with such a broad net. I think it caused some undue panic on people's part, and I take responsibility for that.
There has been a lot of calls, a lot of emails into our newsroom since this first story about AbiMar went public Thursday. How is the city protecting the public and the families of these infected employees from getting this virus? And how are you enforcing that self-quarantine? And is APD going to homes and physically checking if people are being quarantined?
So I'll say the city of Abilene cannot in any way make sure you don't get COVID-19. It's well beyond our scope and ability. Each person has a personal responsibility to take care of themselves, and government is not the solution to much of anything in my opinion. But I do think that we have a role to play, and that role is public education. That role is making sure that we have a cohesive community response to COVID-19, and I think we're doing that in a very good and proactive manner.
We spoke earlier, late last week, Mr. Hanna, and is the city sending a mandate to employees at AbiMar, both those that are infected and those that are not, to self-quarantine for the next 14 days? Or is this simply being done on the goodness of their own will?
Yeah, so I will say two things. One, John, the first is that AbiMar and the city of Abilene are following CDC guidelines, and so are the health practitioners that are administering these tests. And they are asking the people to self-isolate and self-quarantine in the event of positive cases. But I do not have enough police officers to force people to be responsible. I don't want to have enough police officers to force people to be responsible. They have to be responsible on their own. Now, by and large, I think many Abilenians are. And that's one of the reasons why I think being able to keep our numbers down to the extent that we have. We've also been fairly lucky. We don't have some of the hundreds of thousands of cases that some models have predicted that we'd have by now. So I think that that's good. Annette, you want to add to that in any way?
Well, I will say that once we identify a positive, we send them a document that's called a restriction of movement, and it basically tells them what they can and cannot do, that they have been confirmed positive. If someone is quarantining, we don't reach out directly to those because we're not aware of a lot of them. So we've got information on our website that says if you have been asked to quarantine, this is what you should and should not do. And so there's the information that is available, but again, we just do not have the staff and the resources to be able to contact every person individually that may have been exposed. There is some level of personal responsibility to obtain the information on our website, and certainly call if they have any questions about what they need to do.
I just have one more question, and I appreciate all you folks taking the time for us today. We have gotten a few emails that the shipping facility on Vine is still operating. Is this the case?
The AbiMar shipping facility on Vine? I don't know the answer to that question, John. We can verify with AbiMar. I do know that the north side and the south side, the north and south plants are closed. Their production facilities are closed. Whether or not their shipping on Vine is open, I don't know, but it could very well be that they haven't had any COVID-19 positives out of that facility, and that's why they decided to do this. I will say this, AbiMar has been exceptionally responsible and proactive in their approach, and I don't find fault with their actions. They've been on top of this from day one and involved the health department accordingly.
Thanks for your time.
Thank you, John.
Lexus, and also I see Kelly J there with radio, but Lexus and Fox, if either of you have any questions, you think?
Mine are mostly answered too, but I was wondering if how rapid these results are coming in now. Is the Abilene Diagnostics results coming in quicker than the ones conducted at the health department? And since 100% of the AbiMar employees have been tested, when do you have a time frame of when they will all be back, when you'll have them all completed?
So it just depends on where samples are being sent. And even if 2 samples are sent out on the same day, if they've gone to different labs, which I know that Abilene Diagnostics sends to multiple labs, even if they go out on the same day, they may be received at different times because of whatever caseload that individual lab may have. So it really just kind of is dependent on which lab you're using and how bogged down they are.
Awesome. Does that cover everybody there?
Yeah, I was just going to ask a quick question, if I could, for Mr. Mayor there. We were mentioning Councilman Hurt over that task force, more or less. Is there going to be a way that small business owners can have any input with that? Is there an email that they can send their suggestions into?
What we're going to do, and I've asked the city manager and his staff to coordinate a structure that will provide an opportunity for public input. The chamber will also be part of that conversation. We want this to be a productive conversation had in our community that will help guide and lead us, and so we can do this in a very appropriate way. I want to thank everybody. I hope you think this was helpful. We're trying. We're really trying to be open and provide communication. We don't always get things right, and certainly we can always armchair quarterback and do things a little bit differently. But the effort is sincere in trying to be sure that we're providing the best information that we know of at the time, provide back to our community. So thank you.
Mayor,
Yes.
I do have one more question, just real quick, and we're getting a lot of phone calls about it. And this is probably a better question for Annette. Is there any risk for cross contamination with the product, maybe the wrappers that they're serving, that they're wrapping things in at AbiMar?
So I will say that there's not any evidence that we have so far that indicates that our food supply has been contaminated. This is not a situation that's unique to Abilene, Texas. I mean, our food is being produced and packaged in plants all across the nation and even the world. I will say that I do know what's going on in the Abilene plant, and the safeguards that they have put into place, we felt very comfortable with. So it's not any more risky here in Abilene, Texas, as it is in other areas that's producing all the various food products that are on the shelves. So everybody has to make that personal decision for themselves. You know, if you're going to a restaurant and eating food that was prepared, you know, that's your personal decision. So there's just no evidence to suggest that our food supply is contaminated.
If I could just clarify the question that John asked about the Vine. I got some feedback on that now. John, they are shipping from the Vine location. There are no cases from there. There are very few people at that facility, and so social distancing is easy.
Well, again, I'll do my second close and thank everybody who participated, and hope you appreciate the effort that is being brought to the community. We will release an opportunity for a document that looks at AbiMar's time frame for the media and also for our citizens. You can be aware of it. We'll be in constant contact and have chances to provide additional information as it comes forth. Thank you, and have a great day in Abilene, Texas.
And this has been a KTAB News special report. This news conference from the City of Abilene, the Mayor of Abilene, the City Manager, and the Director of the Taylor County Health Department, along with other folks there, doing this news conference. And we'll take a commercial break and be back with KTAB Noon Tab coming up.